Hello, my name is Dr. Ari All, and today we're going to be talking about low dose naltrexone, which is a very interesting new treatment which can help with things like autoimmune disorders, fatigue, energy, and maybe even treatment-resistant depression. So low dose naltrexone I originally found while looking for treatments for long COVID, and what I found was that it is extremely good at decreasing inflammation. But before we get into that, we should understand exactly what inflammation is. We talk a lot about inflammation in mental health, but rarely is it defined or explained to people. There are two types of inflammation. One is called local inflammation, and that's when you would get a cut or your finger starts to get inflamed. And the other is general inflammation, and that's when all of these cytokines and inflammatory markers are just released into your body in general. Now, a local inflammation is a very, very good thing. When let's say you get a cut, the cells around that cut are going to release inflammatory markers. Those are going to gather in immune cells, and they're going to try and fight off that infection. General inflammation can be a good thing. So for instance, let's say that you have a fever, your body is going to release a lot of cytokines and inflammatory markers to try and combat that fever. But if you have too much general inflammation or for too long, it can be a very, very bad thing. And essentially, inflammation is your body's way of trying to fight off some kind of stressor. But if it's always trying to fight off the stressor, really what it's going to end up doing is damaging your body. So we want to try and decrease general inflammation as much as we can, except for in those acute stressors when it would be warranted. A lot of people have autoimmune disorders, which is general inflammation all the time, specifically targeted to things that it is not supposed to target. For instance, inflammatory bowel disease is when your immune system will try and attack your gut, and it can create these awful scars and a lot of terrible symptoms. MS is a disease where it will actually attack your central nervous system and create lesions in your brain. So autoimmune disorders can make people suffer quite a bit. Now, what we found with low dose naltrexone is that it's actually very, very good at fighting these autoimmune disorders. And let's get into exactly what low dose naltrexone is. So naltrexone, the regular drug, not low dose, but regular dose naltrexone, is an opioid blocker. So you have these cells or these receptors in your body that get activated by things like endorphins, which are your body's natural opioids, or something like morphine. And you feel really, really good when they're activated, but when they're blocked, you don't feel so good. Now, for people that abuse opioids, you want something to block those so that they can't use them, and that's naltrexone. It is blocking those opioid receptors. We also found that naltrexone is very, very good for opiate cravings and alcohol cravings and basically any sort of drug craving. So it's blocking that receptor, it's making it so that the opioids can't get there, and then that is having downstream effects that make you less likely to use opioids or alcohol. Now, when you use very low dosages, we're talking about a 10th or a 100th of a dose, has a paradoxical effect where it's blocking it just enough to signal to the rest of your body to create more endorphins, and that is decreasing pain. At these low dosages, it's also going to immune cells like B cells, T cells, microglia, which are the cells in your brain that attack bacteria. It's going those and essentially telling them to slow down a little bit and to stop releasing inflammatory markers and cytokines. Now, if you're somebody who has an autoimmune disorder or just general inflammation, that can be excellent because it's lowering that general inflammation. Now, there are natural ways to fight inflammation, and I encourage all of my patients to engage in those. Those would be things like an anti-inflammatory diet or meditation or exercise. The issue with those is that it's very difficult to do, and it's very difficult to get somebody to do, especially if they're in pain, especially if they're depressed. You can tell them like, hey, why don't you go out and eat all these fruits and vegetables? But they're like, look, I can't even get out of bed. I'm ordering Uber Eats all the time. Like, I literally can't do anything. How am I supposed to start this really intense diet? So for them, having something like a supplement or a pill is extremely, extremely useful. What does the research say about low dose naltrexone? It's quite interesting. So for fibromyalgia is a disorder where people will get pain spots all over their body. They have cognitive impairment, they can't sleep, they have extremely low energy. It's very debilitating for people. And side note, we're not entirely sure what causes this, We think that, or at least in Europe, they think that this might be a post-viral syndrome. So people get an infection that activates their immune response and then it just never shuts off. But we really don't know. So people with fibromyalgia can be in a lot of pain. The studies that have come out have shown that about 50 to 60% of people with fibromyalgia will have a very significant decrease in pain and fatigue if they take low dose naltrexone. Same thing with inflammatory bowel disease. So we talked about that earlier. That is where your body is attacking your gut. It's creating these scars and these wounds. And not only did it decrease their symptoms of GI distress, it also made the wounds heal for inflammatory bowel disease. So that's pretty incredible. There's been some studies that are mixed evidence on multiple sclerosis. That is where your immune system goes and attacks your brain and central nervous system. And some studies say that works, some say that there was no effect, but they're still studying it. So it could be a very useful tool to treat people with MS. Now, what interests me about low dose naltrexone is its use in psychiatric patients. And what I have found empirically is that it increases people's energy, it decreases their pain, it increases their ability to sleep, and it decreases their depression. Now, one thing that is interesting about antidepressants work very well, but they do not work as well in people who have high inflammation. So if you can lower their inflammation and then give them an antidepressant, it's going to work much, much better. And I think the studies, I can't say for sure, we still need to do more research, but I think what the studies are going to show, which is promising, is that if you give someone low dose naltrexone and an antidepressant at the same time, you're going to get a lot more people that respond to it. And maybe some of those people with treatment resistant depression or treatment resistant anxiety are finally going to be able to find something that actually decreases their depression or anxiety. So in summary, everyone has inflammation. We have general inflammation and local inflammation. Too much general inflammation can really do the body harm, and it can decrease your mental health. If you can find something that decreases general inflammation, all the better. And something like low dose naltrexone in the dosages of 4.5 or even 0.5, which is about a tenth or a hundredth of a dose, can really, really be helpful in decreasing that inflammation. Now, there are side effects, but they're very few and far between. I think the most common one was vivid dreams. Some people got a little bit of an activation effect, which they can feel as anxiety, but in general, it tends to be pretty low side effect. Obviously, you want to talk to your doctor or medical professional before starting any supplement or any treatment, any med. But this may be a good treatment for you if you have suffered from autoimmune disorders, chronic pain, low energy, or treatment-resistant depression. If you like this video, please subscribe below or share any research with me. I really like reading about this stuff, as you can tell. And thank you guys so much for watching.